off that because you really segued into something that I wanted to ask you about, and that is, I guess it 08 through 2011, we had economic recession. I mean, I guess you could argue when it started and if it stopped.
Has it stopped?
I don't know. I mean, so
is it
I thought this was the new normal.
yeah. So anyway, given the recent and current economic climate, you talked about complex dentistry and, comprehensive treatment plans or cosmetic or, more than just the operative dentistry. Has the recent and current economic climate changed how patients are perceiving complex or comprehensive treatment? And has it changed how dentists are perceiving and presenting or not presenting that kind of treatment?
Oh, I think the answer to that's obviously yes. It's really interesting. I mean, one of the reasons that I made a transition in 2011 was that I kind of felt like for me to stay relevant as an educator, I had to be a practicing dentist. I left active practice the end of 2004. I went back into practice in 2011. I mean, talk about totally different economic worlds.
Right.
Not to mention dentistry, technology and techniques and things that had changed in those intervening years. One of the things that has always been true about my practice, whether it was in 2004 or now, in 2015, is my patient base is pretty much middle income, maybe upper middle income folks. I got lots of school teachers and yet I do probably more comprehensive or complex dentistry than most dentists do in their practices. Now I got to tell you, I have patients in my practice who just need hygiene. And I see them once every 6 months just to say hi and, make sure that things are just as healthy as they used to be, or a buccal pick composite here or there. But I also do a fair amount of what we would call higher end dentistry. And what I've kind of learned over the years is part of that is helping people decide that they want that for themselves. Because often that kind of dentistry isn't something you need.
Right.
It's something you decide you want for yourself. And it's amazing to me that all of us, when we decide we want something, are really pretty effective at figuring out how to make that happen. And then you add to the puzzle that if you're treatment planning people comprehensively, if you're really looking at everything and you're sitting out and strategically treatment planning, the most complex dentistry on the planet can be divided up and phased often over lots of years. So you can say to people, okay, here's the big picture. This is the end game. Now you tell me, how does it work to do it? How much do you want to do a year? Whether that's an economic concern or sometimes it's just logistics. They just don't want to sit in a dental chair that much. So I like to joke that, in dentistry, you can buy your Mercedes a door at a time. Because most of that is actually true. It's not always true, but it's mostly true.
Right.
So, I think the hardest piece is learning how to help people decide that they want that. Getting them from, I called your office to have my teeth cleaned, to I'm going to spend, a lot of money and a lot of time, and I'm going to take my 50-year-old mouth and turn the clock back so that I have a 25-year-old mouth. That's the hard piece.
Is there an element of playing counselor to a certain extent that it's okay to want that? I mean, do you ever find that some patients feel like there's either a certain aspect of selfishness to that, or that for some reason that they need to be told that it's and that it's okay to want that and to go for what they want?
Yeah, I think that's always true. And I can tell you personally, I mean, I had my dentistry redone. I had what you would basically call a full mouth rehab in 2006 or so. I've been thinking about it for 10 years. Like, it's something like I knew that I wanted to do for a better part of a decade. And honestly, for me, what got in my way was two things. One, finding somebody that I trusted enough to partner with to do that dentistry. And I think it's hard as a dentist to trust another dentist to do that kind of care. Right. It's equally hard for a patient to put yourself in somebody else's hands like that. And the other piece of it was, as a young mom with 3 kids where we're saving for college educations and, all of the things that came up in life, it was really hard for me to, it wasn't that I couldn't write the check. It was, am I worth writing the check?
Right.
Does it make sense for me to pay this money to have dentistry done instead of putting in my kids' college savings plan? Mm-hmm. That was the huge transition for me. And I made that journey kind of on my own without the support of somebody. I think you're right, Michael. I think part of our job in the dental profession is to give people an outlet of somebody who can talk, they can talk that through with, who will understand that. It doesn't mean you need to stand behind them and say, you need to get this done, right? You need to just be able to be there and let them process. And one of my favorite questions for my patients when they're not moving ahead with dentistry is to simply say to them, you don't have to if you're not comfortable, but I'd love to know what's getting in your way of setting this up, if you even understand what that is. And it's just, it can be a single crown. I have patients in my practice all the time for hygiene where we treatment planned a crown 3 hygiene visits ago, and they're still not getting it done.
Right.
And to be able to say to them, if you're willing to share this and you even know the answer to it, I'm curious what's getting in your way of getting that crown done. It's an unbelievably powerful opportunity for them to look inside and go, what is getting in my way of that? Okay. And it's amazing how often then they actually move forward with treatment. And when I first started asking that question, I kind of defaulted to, they're all going to say it's the $500 that their insurance doesn't pay or the whatever. I hear about money when I ask that question very rarely. I hear about stuff like, the people will literally look at me and they'll go, is it going to hurt?
Yeah.
And you think you've explained that, but
right.
maybe not, or it's amazing the questions you get, and sometimes they'll just say to you, I know I need to get it done. And I'm not looking forward to sitting in the chair.
Yeah. Perhaps the biggest trick, or trick's not the right word, but the biggest insight on better case acceptance, which is really what we're talking about, right? We're trying to, you're a doctor who's communicating this medical need, right? And people say, maybe, no, I'll think about it, whatever, is being a better listener to help you be a better communicator. And that I think is a struggle for a lot of people inside and outside of dentistry, is first of all, to be a good listener, but then to be able to kind of hear what you're saying and then modify my answer to what your needs are, right? Most people just go in and say, well, here's it is. The crown is this. It costs this. It's going to take this long. When do you want to do it? Right? And that style of communication is kind of not going to work, right? It doesn't work as well as learning this deeper. And this is, to me, a good example of just getting to know the patient so well, and just that deeper relationship where they trust you, which is so vitally important. It's no longer just an insurance question or a time or money thing. It's so much deeper than that. So what else do you do? What else do you do in your practice to get to know your patients and kind of make them feel comfortable? And I know clinically you've got all that, but what else do you do that helps connect with patients?
I think you just hit on it. It's really about just being willing to listen to them. And, and part of that is listening, but part of what I've learned over the years is learning to ask questions that help people process what's going on for them by answering you, so asking pretty strategic questions so that they get to talk through sort of what's going on. And, the model that you talked about, which is what we all learned in dental school, by the way, exam, diagnosis, treatment plan, patient rushes to the front desk and says yes. That works really pretty well for simple stuff like you need a filling or, you need some perio treatment because the media's made it so well understood. It works almost not at all when you start talking about more complicated kinds of dentistry. So part of that is helping people figure out for themselves, what do they want from their oral health? And I'll ask them that question. I'll say, when you think about your dental health 10 years from now or 20 years from now, I'm curious, what does that look like?
Right.
And really being able to get and often they don't know the answer to that, but because you ask it, they will go home and think about it. They'll figure that out. The other thing for me is that I've learned to present dentistry over the years by helping patients understand the possibilities for addressing whatever it is they're concerned about it. And then what are the risks and benefits of that particular pathway? And risk and benefit can be technical, but they can be fiscal. they can be time-based, they can be discomfort-based. And so I just address all of that. And, and for a lot of dentists, I think we see it as the elephant in the room. Like you don't want to say to a patient, this particular procedure, you're going to have some pain for 3 to 7 days, or, when I just approach it as, everything we do has a certain set of risks and a certain set of benefits. And what I want to do is help you understand. You could do A, and here's those risks and benefits, or you could do B with a different set of risks and benefits. And I say to my patients, I say, and your job is to decide which of those two paths seems like the best fit for you based on your goals. And then I stand back and I accept their decision. And that's the other big piece of that puzzle is, if you're going to approach it that way, you do have to trust that people will choose what's in their own best interest.
Right.
Yep. So I'm going to switch gears a little bit here because sometimes I'm a gear switcher.
You are.
And I want to talk a little bit about technology.
Okay.
And I want to know, I think I ask this a lot, so I want to know from you, inside the practice and in your personal life, what are some technologies that you cannot live without?
Oh, what are some technologies I can't live without? Well, and I think some of them are pretty basic. In my practice, when I bought the practice, I converted to digital radiography because I just think there's just so many benefits over traditional, including advanced radiography. So, panoramics. And I actually have a really great deal where I can get cone beam CBCTs because I work in a professional plaza. And so we actually have several specialists who we can, just kind of sort of share technology with them. So that's a must. As far as, like digital impression systems, I actually don't have one in my office, although I've played with probably about everyone you can think of. And I do think that I kind of consider it a must-have, except I don't have one because I have a really big 6-figure note from 3.5 years ago when I bought my practice. So it's sort of on my wish list once the economics of the practice can support that. I actually use a digital anesthetic delivery system called the Wand and it's been around for like 15 years and everybody uses it. I don't know whatever happened, but I wouldn't practice without it. I wouldn't have anybody give me anesthetic without it, and I wouldn't practice without it because it makes such a big difference in patient comfort and experience. I have a Velscope, so we use that on everybody, and I think that's just a phenomenal technology. You only have to have one patient where you find something that nobody else has found for them.
Right.
If you're like, I can't believe we weren't doing this before. So you're putting me on the spot, so I'm trying to rattle it off.
Well, let me ask you this. What technology do your patients comment on the most that they either see or you use on them and they go, wow, I've never seen this. I've never seen a dentist with one of these.
Right.
I'm going to tell you, it's the Wand. It's giving them anesthetic. Every single patient I do it for who's never had it done in my practice before is like, that's so much better than the old way.
Right.
And I'm going to say, well, it's actually old too. It's been around for like 2 decades. But
don't tell anybody.
Exactly. But it's just because it's not widely adopted in dentistry. To almost every patient, it's brand new, and they're like super impressed by it. I think patients in general want us to be state of the art.
Yep.
I think patients are impressed, not only that we have it, but that it says that we're staying up to date. It says they infer something about the rest of our knowledge base when we have modern technology in our practices, you know. So I think you could say that about lots of different things.
Yeah, we talk about that a lot with the brand of the practice, how it's, we say that these patients, we like to call them patients because they are patients, right? We're in this medical setting, but really they're consumers, right? And some people get that and some people don't. And that's probably a conversation for another time, but it's really, once you look at them like consumers, and not in a bad way, not like we're trying to rob from them or steal from them, and you learn to communicate to them like, you have choices, this is what it is, this is how long it's going to take, and you treat them like they're like they're real consumers in the real world. I think it changes the mindset of how you talk to them, and then you understand how they perceive you. Because what you just said makes total sense, and I believe it too. Is that if you've got technology in your practice, the perception is you are probably better and smarter than you actually are. And not saying that people aren't, but it gives you that edge that why wouldn't you have it?
And it changes how they talk about you.
For sure.
Absolutely.
And so, that goes to, obviously word of mouth, and that's important, in a dental practice for sure. Yeah. So if they can go and say, hey, in Dr. Brady's practice, the injection was nothing because she uses this cool thing.
This 20-year-old technology that she dusted off and stuck in my mouth.
Well, it's new to them. I mean, we just got to work on that presentation.
All right, so last question, and this is a softball. So if you weren't practicing dentistry, what would you be doing with yourself these days?
I have no idea. People ask me all the time what I'm going to do when I retire, and my answer is I'm not planning on retiring. I mean, that's one of the things I think is a gift of dentistry is, unless I lost my eyesight or, God forbid, something like that happened and you can't do clinical dentistry, you can find a way to be part of this profession pretty much for your whole life. And it is, people say, what do you do for fun? I'm like, teeth. And they're like, no, really. Like, what do you do for fun? I'm like, teeth.
That's what I do.
Because, it's my vocation and my avocation. And I love this profession. And so whether I teach as an ongoing thing at some point, because I don't want to see clinical, be in clinical dentistry, or, I do a lot of TMD. So even if I ever get to a point where I say I can't prep teeth or I don't want to do, that kind of dentistry, that there's a way for me to stay in dentistry and to be active in this profession. So, I guess my answer to your question is I don't plan on not doing this, so I don't know what I would be doing if I wasn't doing this.
That's a great answer.
That's an awesome answer.
We actually sympathize because we have no other skills other than this.
Right, and I don't know if you would call this a skill.
I would not call this a skill. So one of us is skilled.
Yes, one of us is. So on that note, we really appreciate you spending a few minutes with us. It was awesome. Thanks a lot.
My pleasure. Thanks for having me, guys.
Of course. And that wraps up another edition of the Dental Insiders podcast. We'd like to thank our guest, Dr. Leanne Brady, for joining us and spending time with us today. And thank you, listeners, for spending time with us as well. Please join us next time and tell your friends and colleagues about the Dental Insiders podcast.